SITC annual meeting held virtually. The purpose of this call is to provide an expanded analysis of the clinical efficacy signals from the U.S. phase 1 trial, which is not previously discussed. Now, without further ado, I'll hand over the call to our chairman, Dr. Zhen.
Thank you, Jaren. First of all, I would like to thank you all for joining this call today. On this call, we will provide you with an updated summary based on our expanded analysis of phase 1 clinical trial data on lemzoparlimab, our differentiated CD47 antibody. The data summary is already posted on IMAB's website with a link that is indicated in our meeting announcement. Now, without further ado, let me start to summarize the data of this single-agent dose escalation study in patients with advanced solid tumor. The study was conducted in U.S. clinical sites. The data can be summarized in 4 aspects. First, lemzoparlimab was well tolerated among all dose cohorts from 1 milligram per kilo up to 30 milligram per kilo. No DLT or severe hematologic toxicities were observed. We only observed a few cases of mild anemia, mostly grade 1 anemia, without evidence of hemolysis. This well-tolerated safety profile is consistent with the key differentiation of lemzoparlimab that binds minimally to red blood cells back in eye. Second, lemzoparlimab exhibited a favorable PK profile. At mid or high doses, it did not show a sink effect. We consider this an important clinical advantage, as a sink effect may influence clinical efficacy of the drug. Third, lemzoparlimab shows a expected receptor occupancy. It had reached maximal receptor occupancy at a 20 milligram per kilo and a 30 milligram per kilo. It is important to mention, unlike other CD47 antibodies, for example, magrolimab from 47 and latepilumab from Innovent, and because of its minimum binding to red blood cells, lemzoparlimab did not require priming dosing, which is considered another advantage in a clinical setting. Let me now summarize the efficacy data. As a single-agent treatment, lemzoparlimab demonstrated a promising efficacy signal. Among 16 evaluable patients with advanced solid tumor, we observed 1 partial response, PR, and 3 stable disease, SD. This PR is a case of advanced melanoma with a liver metastasis. The patient had a prior treatment with checkpoint antibodies for at least 6 months and progressed on treatment before entering our study. He remains on the treatment now and maintains as a PR. The 3 SD patients are squamous carcinoma of the tongue, ovarian cancer, and renal cell carcinoma. One of the SD patients, or stable patients, was originally determined as a PR and later was unconfirmed. It is also important to mention that many patients remained on the treatment for a good duration. The longest is 280 days on treatment. In conclusion, we are very excited that overall clinical trial results support the key differentiation of clinical advantages of lemzoparlimab in terms of drug safety and a favorable PK profile. Now, the preliminary anti-tumor activity of lemzoparlimab as a single treatment agent is promising in our view. We are now continuing the study in the U.S. to combine lemzoparlimab with Merck's PD-1 antibody to evaluate safety and efficacy in patients with solid tumor, and Roche's Rituxan in patients with lymphoma. In addition, we're in the middle of a parallel clinical trial in China to focus on patients with AML and MDS to evaluate safety, efficacy signal, and the data expected early next year. Going forward, we will work together with AbbVie to facilitate the clinical development of lemzoparlimab for AML and MDS, as well as solid tumor, both globally by AbbVie and in China by AbbVie. We're very excited about the potential of lemzoparlimab as a differentiated CD47 antibody in this crowded space. Now, thank you for your attention. We can now begin the Q&A session. Both June and myself are very happy to address questions that you might have.
Rachel, I think we're ready to take questions.
Certainly. Ladies and gentlemen, we will now begin the question and answer session. If you wish to ask a question, please press star 1 on your telephone and wait for your name to be announced. If you wish to cancel your request, please press the pound or hash key. Once again, to ask a question, it's star and the number 1 on your telephone keypad. Your first question comes from the line of Louis Chen of Cantor. Please ask your question.
Hi, congratulations on the additional data, and thanks for taking my questions here. First question I had for you is, why do you think there wasn't a dose response on the anemia patients? Is it because it's just small numbers? And did the anemia lead to any drug discontinuation, and how was it treated with the patients? And then my second question for you is similar on the higher anti-drug antibody, just saw more in the lower doses. Is there another explanation for this, or once again, small patient numbers? And do these patients need to stop treatment, or can they continue? Thank you.
Yeah, let me take your first question. The anemia we observed in our clinical trial is mild, mostly grade 1 anemia. So after the first dose, we typically see in some patients there was a drop of hemoglobin within about 10%. So it's a really mild drop. And this mild anemia did not require any treatment and did not have any clinical consequences, as we know. It's quite clear. Now, this mild anemia was also observed in our preclinical GLP tox study. And also in GLP tox study in monkeys, we observed a very similar phenomenon, which is also not those independent, not related to those. And we think that perhaps this is a antibody binding, some weak antibody binding to red blood cells in some cases, and this could induce a slight decrease of the red blood cells. And this is how we view the data.
Yeah, I just want to add Dr. Zhang's comment. We've seen in the old red blood cells, they typically showing don't emit signals like weaker. So, and I think those are the natural course of the depletion of those red blood cells. So we believe that's why it's only a certain part of it. That's why it's not dose dependent. And then maybe I just want to go for the ADA questions you had raised. So in total, we only have 5 patients have been confirmed with ADA, but none of them had any impact on safety and the PK profiles. Hope that answered the question.
Yes, thank you.
Okay, Rachel, let's take the next question.
Your next question comes from the line of Kelly Shi of Jefferies. Please ask your question.
Hi, thank you for taking my questions. Can you please comment on if these three stable diseases are clinically meaningful? Do you see tumor regression? And to what extent? I assume the one PR and converted to, one initial PR, you probably have seen some tumor regression. And also, how long have they been on the treatment individually? And also, what are the current status of these three patients in stable disease? And lastly, do you see any potential for the tumor response continue to deepen if they're still on the trial? Thank you.
So, Dr. Shi, let me try. So, for addressing the first question for the PR case, the patient was on Nivo for at least 4 cycles, and with confirmed progression of the image. And then the patient was on both Nivo and EP for another, at least another 2 or 3 cycles, and then was confirmed progression again. And then 2 cycles after, and then the patient was on our drugs. So the image had 3 consecutive confirmation of this PR. So the patient stayed for the series of PR confirmations, and then actually the trends of reductions continued with the third one. So that's how we think that's. So the patient later was PR'd, disease progression, but in terms of the other 3 disease, stable disease, I can share with you. So the first one, the patient was 1 milligrams only, and the patient actually were on the studies for pretty long durations, and I can show you later. So he stayed for 8 full cycles of treatment with 3 scanned confirmed stable disease, and then so until progression after that. So the second patient who is ovarian cancer with metastasis to the lungs, and she was on the 10 milligram per kilo cohort, and it was also with a confirmed SD for 2 scans, and then the patient continued to stay until the disease progression after that. And then the third, the SD was a renal cell carcinoma patient with metastasis to the lungs. And then this patient was on 30 milligrams per kilo and was heavily treated with chemo. And then also with I just want to mention, this is only one PD-L1 expression was confirmed. It's low, it's positive, less than 1%. So it had 2 scans confirmed SD. So actually, this patient is continuing on the treatment after cycle 7 because the data is still relatively new. So we didn't have the follow-on after this. So these are the 3 patients currently confirmed with SD.
Kelly, there's comments I like to make. We were pleasantly surprised to see 1 PR, 3 SD among 16 evaluable patients. Remember, this is a single agent treatment.